Did you know about this pulmonary embolism? You might know it as that scary blood clot we hear about in the lungs, but there's a lot more to it than that. We're going to break it down, talk about why it's often missed, and most importantly, how to prevent it. Now, I know what you're thinking, this sounds intense, and you're right, it can be, but knowledge is power, and understanding this condition can literally save your life or the life of someone you love. So if you're ready to get informed and empowered, stick around because we're about to uncover 5 shocking facts about pulmonary embolism that everyone needs to know. Okay, let's talk about why pulmonary embolism is so tricky. You see, the symptoms can be really sneaky, mimicking other common conditions. We're talking about things like shortness of breath, which could easily be mistaken for a tough workout or even just being out of shape. Then you have chest pain. Now, obviously, chest pain sends up red flags, but even then, it might not scream blood clot in the lungs. It could be mistaken for heartburn, muscle strain, or even a panic attack. And to make matters worse, sometimes the symptoms are so mild, they're barely noticeable, especially in the early stages. This is why it's so important to be your own health advocate. If you're experiencing any unusual symptoms, especially those involving your chest or breathing, don't brush them off. Talk to your doctor, and if you're not getting answers, don't be afraid to get a second opinion. Remember, early diagnosis is key when it comes to pulmonary embolism. The sooner it's caught, the better the chances of successful treatment and a full recovery. There's this dangerous misconception out there that pulmonary embolism only affects older adults. And while it's true that age is a risk factor, it's definitely not limited to our grandparents. The reality is pulmonary embolism can affect anyone, regardless of their age. We're talking young adults, athletes, even children. It's not about how old you are, but rather a combination of risk factors that can make you more susceptible. We'll dive deeper into those risk factors later, but for now, just remember that age is not a shield against this condition. If you're experiencing any unusual symptoms, don't dismiss them thinking, "Oh, I'm too young for that." Listen to your body, and if something feels off, get it checked out. It's always better to err on the side of caution when it comes to your health. Let's talk about those sneaky symptoms again, because recognizing them early can be life-saving. We've already touched on shortness of breath and chest pain, but there are a few other red flags you need to be aware of. One is unexplained dizziness or lightheadedness. If you suddenly feel faint or like you're going to pass out, especially when you stand up, that's a sign that something's not right. Another is a rapid or irregular heartbeat. Your heart might feel like it's racing or fluttering in your chest. And then there's coughing, sometimes accompanied by blood. This is a more serious symptom and definitely warrants immediate medical attention. Now, it's important to remember that experiencing 1 or 2 of these symptoms doesn't necessarily mean you have a pulmonary embolism. But if you're experiencing several of them, especially if they come on suddenly or worsen rapidly, it's crucial to seek medical attention right away. Pulmonary embolism is not something to take lightly. If left untreated, it can be life-threatening. That's because the blood clot blocking the artery in the lung can prevent oxygen from reaching the rest of the body. This can lead to serious complications, including heart failure, permanent lung damage, and even death. But here's the good news. With prompt treatment, most people make a full recovery. The key is to recognize the symptoms early and seek medical attention immediately. Treatment typically involves blood thinners to prevent the clot from getting larger and to help the body naturally break it down. In some cases, more aggressive treatments like clot-busting medications or procedures to remove the clot may be necessary. The bottom line is the sooner treatment begins, the better the outcome. Now let's talk about those risk factors we mentioned earlier. While some risk factors like family history and certain medical conditions are beyond our control, there are several lifestyle choices that can significantly increase your risk of developing pulmonary embolism. One of the biggest culprits is smoking. Smoking damages the lining of your blood vessels, making you more susceptible to blood clot formation. Another major risk factor is prolonged immobility, such as sitting for long periods, especially during long flights or car rides. When you're immobile, blood flow slows down, increasing the risk of clots forming in the legs that can then travel to the lungs. Obesity is another risk factor, as excess weight puts extra strain on your circulatory system. Other lifestyle factors that can contribute to pulmonary embolism include birth control pills, hormone replacement therapy, and certain medical conditions like heart disease and cancer. The good news is that there are things you can do to significantly reduce your risk of developing pulmonary embolism. One of the most effective ways is to stay active. Regular exercise helps improve blood flow and circulation, making it harder for clots to form. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Another crucial step is to stay hydrated. Drinking plenty of water throughout the day helps thin the blood and prevents dehydration, which can increase your risk of clotting. If you're traveling long distances, make sure to get up and move around every hour or so to keep the blood flowing. And if you have any of the risk factors we discussed, talk to your doctor about ways to manage them and reduce your risk of pulmonary embolism. Remember, prevention is always better than cure. Thanks for watching. If you found this video helpful, don't forget to like, subscribe, and hit the notification bell for more health tips. We covered a lot of ground today, but the main takeaway is that pulmonary embolism is a serious condition, but it's often preventable. By understanding the risk factors, recognizing the symptoms, and making healthy lifestyle choices, you can significantly reduce your chances of developing this potentially life-threatening condition. And remember, knowledge is power. Share this video with your friends and family to help spread awareness about pulmonary embolism. Stay healthy and stay informed. Prevention is power.